Hi everyone, welcome to Pathopulse_Radhika. So, welcome to this PPT on a series of tumors of female genital tract. So, the tumor for today is going to be a germ cell tumor. But before going into the proper discussion of that germ cell tumor, let me just give an overview of the ovarian tumors. Okay, so you have different types of ovarian tumors. So, how does a ovary look like and what does the ovary have histologically, right? So when you take a ovary, the ovary is lined by a type of epithelium on the surface that we call it as the surface epithelium. Then you have the germ cells. So you can have tumors originating from germ cells. Then you have the stroma between those germ cells that we call it as stroma, and you can have a combined sex cord and a stromal tumor. So depending upon where it originates, the ovarian tumors are classified into surface epithelial tumors, sex cord stromal tumors, and the germ cell tumors. So any tumor which originates from the surface epithelium, we call it as a surface epithelial tumor. And depending upon how it looks, it could be a serous cystadenocarcinoma, your mucinous carcinoma, your endometrioid carcinoma, clear cell or transitional. And when you take germ cells tumor, all of you must have heard about teratoma. This is one of the most common germ cell tumor. Then you have dysgerminoma, which is the female counterpart of seminoma. Then you have yolk sac tumor and embryonal carcinoma. You have choriocarcinoma as well. And the topic for today is going to be yolk sac tumor, right? Then you have sex cord stromal tumors, where we have granulosa cell tumor, your fibroma, thecoma, and sertoli Leydig cell tumor. So this is a easy outline of how ovarian tumors are classified. So for you to understand from where the tumors originate from, right? So any tumor which originates from the surface epithelium, we call them surface epithelial tumors. Those from the germ cells, we call it as germ cell tumors. And those which could be from the stroma and the sex cord, we call it as sex cord stromal tumors. And let's go to the today's tumor. So this is how a tumor appears. Of course, it's very difficult to comment based on the gross appearance, but you can just make a differential diagnosis based on the gross appearance, right? So this is basically a ovary with a tumor. So this tumor has got different areas, right? So just look and tell me how it appears. So whatever you're describing how it appears is the gross appearance of the tumor, right? So when you see it's a cut surface, it has got predominantly cystic areas. Like here you have a cystic area, right? Are you convinced? There are some solid areas, right? So remember, necrosis usually appears yellow in color. All these are necrotic areas. Then you have cystic areas filled with a reddish brown material. That's all probably hemorrhagic. So it's predominantly a cystic tumor with areas of hemorrhage and necrosis. So this is a gross appearance of your yolk sac tumor. So remember, yolk sac tumor can occur as a pure entity, only the component of yolk sac tumor, or it can be a part of mixed germ cell tumor along with other tumors, right? So depending upon the age, it can occur either alone or as a part of a mixed germ cell tumor. So this is about the gross appearance of yolk sac tumor, and yolk sac tumor is usually common in children and young adults, especially in infants. Okay, so it's a tumor of young children, right? Especially infants, right? Next is the histological appearance. So yolk sac tumor is one which has got a varied histological appearance. It can appear in different forms. You can have papillary structures, right? You can have tubular structures, or you can have something like this. What is this? Here you have multiple cystic spaces, small cystic spaces. Okay, so these are called a microcystic pattern. So it can have any pattern. You have a huge list of it, but basically remember it can have a varied presentation histologically, right? But there are certain clues to the diagnosis of yolk sac tumor. So this you need to know from the entrance exam point of view. So what is this? So this is called Schiller dual bodies. So this is called Schiller dual bodies. So what do you mean by Schiller dual bodies? So does this resemble any other structure? So it resembles like a glomerulus of a kidney. So when you take a glomerulus, you have a Bowman's capsule, then you have a lot of capillaries. Okay, so this structure is called Schiller dual bodies. So what is a Schiller dual body? So here in the center you have a blood vessel. So all these pink stuffs are RBCs, right? Then this central blood vessels is surrounded by tumor cells, which is already located within a space and again surrounded by a layer of tumor cells, right? So this is called a Schiller dual bodies, which resembles glomerulus, and Schiller dual bodies can be seen in yolk sac tumor. So this you should remember. So the other name for yolk sac tumor is called endodermal sinus tumor. Endodermal sinus tumor. So on gross appearance, whenever you see a tumor in young age, especially infants with solid cystic, predominantly cystic hemorrhagic area and Schiller dual bodies, think always of yolk sac tumor. Are there any other clues to diagnose yolk sac tumor? Yes. So you can do a lot of blood investigations. So certain tumor markers can be elevated. So one tumor marker which can be elevated is alpha fetoprotein. So whenever you have elevated alpha fetoprotein in an ovarian tumor, make a point to search carefully for yolk sac tumor areas. There might be some hidden areas. So usually elevated alpha fetoprotein is seen in yolk sac tumor. So this you should remember very clearly, right? So don't confuse Schiller dual bodies with Kohl-Exner bodies. Kohl-Exner bodies are seen in granulosa cell tumor, which is a Sexcott stromal tumor, which we'll see in further videos, right? So yolk sac tumor will usually has Schiller dual bodies, right? So one more point which you should remember is this is again a yolk sac tumor, but what are you seeing here? Some pink blobs. Are you able to appreciate these pink blobs? So these are called hyaline globules. So hyaline globules can also be hyaline globules or hyaline droplets can be seen in case of yolk sac tumor. Okay, so these are certain diagnostic clues for yolk sac tumor. So let me summarize the findings of yolk sac tumor. So what type of ovarian tumor is it? It's the germ cell tumor. It's a germ cell tumor. It's the second most common germ cell tumor. The most common germ cell tumor is usually a benign cystic teratoma, right? It's a germ cell tumor. And microscopic grossly, it has a predominantly cystic appearance. You can have solid areas. There can be hemorrhage and lot of necrosis. And histologically, they have a varied appearance. You can have papillary structures, microcystic areas, a solid pattern or any other pattern, but there are certain clues for the diagnosis. So what are those clues? You have Schiller dual bodies. So what do you mean by Schiller dual bodies? They resemble glomerulus. They have a central blood vessel which is surrounded by tumor cells, which is lying within a space which is again surrounded by tumor cells. This is called Schiller dual bodies, right? Another clue to the diagnosis is the presence of these hyaline droplets. And the most important thing is you can have elevated levels of alpha fetoprotein, and it's a malignant germ cell tumor, right? So these are the important points which you should remember about yolk sac tumor, right? So now, having discussed about yolk sac tumor and alpha fetoprotein, let me try to correlate with other age groups and other tumors. So I'll give you three patients, a history of three patients, right? Patient number 1, patient number 2, and patient number 3, right? So these three patients are of different age groups, but what is common is elevated alpha fetoprotein levels. Elevated alpha fetoprotein levels is common for all these age groups. Now let me tell you the history of the first patient. First patient is a 1.5-year-old male with a painless enlargement of testis. Okay, what would you suspect in this case? Painless enlargement of testis with elevated alpha fetoprotein. This is your first case scenario. Next is a pregnant lady. It's a pregnant lady who has elevated levels of alpha fetoprotein in the antenatal period, and she was ordered a ultrasound abdomen, right, to find out if there are any anomalies, right. Third one is a 65-year-old male who is an alcoholic, chronic alcoholic, who was diagnosed to have a mass in the liver with elevated alpha fetoprotein. So the common baseline for all is elevated protein, but the difference is in the history. The main difference is the age and the organ which is involved. The diagnosis is different. So if I'm just going to give a elevated AFP, it's very difficult to diagnose because it can be elevated in many conditions, right? So you have to always ask for a history, and history is very, very important. So now what's the diagnosis in the first case? It's a young male with a testicular tumor. In this case, you have to think of yolk sac tumor, right? Next is a pregnant lady in the antenatal period with elevated alpha fetoprotein. So alpha fetoprotein level elevated during pregnancy, always think of neural tube defects. So neural tube defects can be prevented by administration of folic acid. So neural tube defect has to be ruled out. So third one you all would have guessed, chronic alcoholic with elevated alpha fetoprotein. You have to try ruling out a hepatocellular carcinoma, right? So lab investigations is to be always correlated with the clinical scenario and the other patterns, right? So it's very important you ask the history to the clinician always, right? So this is about the yolk sac tumor, and with emphasis on the different conditions where you can get elevated alpha fetoprotein. Thank you so much for your patient listening. Let's meet tomorrow with another video on ovarian tumors. Thank you.